What's this?
Spleen.
Nope.
Diaphragm.
Diaphragm. Good. Okay. This is the spleen. This is not the pancreas, okay? The spleen has a nice defined border to it. You can see the, what was this called?
Greater omentum.
Good. Greater omentum was attached to it. Finding the pancreas, okay, you're going to flip the greater omentum back, look at your spleen, and go towards your stomach, and you can see these granular structure that runs here, okay? Kind of looks like squished packing peanuts, okay? That is the pancreas. So less defined border running between is the pancreas, and that is your spleen. In regards to the small intestine, don't worry about the ducts. Know them for the human, not the cat, okay? In regards to the regions, if I'm up here near the stomach, I'm in what region of the small intestine? Good, okay? If I have a pin in the center here, where you really don't see either end, jejunum, good. And then down here, where you can clearly see the large intestine and small intestine would be ileum, good. And for the regions of the large intestine, I would sort of tuck the small intestine behind so you can clearly see the curvature of it. And, okay, corners would be your flexures. Pin here would be descending, ascending, transverse, sigmoid colon. Okay? And then we have the gallbladder in here. Okay? So that's the digestive system in a nutshell. Some things to keep an eye out for. Okay? Moving on to the urinary system. Okay? The kidneys are retroperitoneal. They are anchored to the posterior wall of the abdominal cavity. Okay? They're going to be anchored by a lot of fat. Okay? So what you're going to need to do is clear away some of the fat, but be careful. You want to find your ureters. There's one that comes off of each kidney and goes to our bladder. It may be easier for you to start at the bladder and work back up. Okay? They're not injected. Okay? So you're not going to see much color change in them. Okay? So here's one ureter here, and then on this side, this one has not been cleared away yet. Okay? So follow that to the bladder. Okay? Your adrenal glands sit on top here. So if you look, everyone wants to take a peek. You can see the kidney stops here, and there's this little triangle of glandular tissue above the forceps. That is your adrenal gland. Okay, just like in the humans. Typically, it gets removed in the cat when you move away the fat. So just be careful when you're clearing out that upper portion of the kidney. Okay. You also should be able to identify where the renal artery and vein enter and exit at the hilus. Our bladder. Okay, in order to maneuver, what I want you to do is push the bladder and the urethra down and pull up on the skin. Okay, what I want you to be able to do by doing this is to identify the urethra. Okay, these globular structures here are lymph nodes. Okay, they differ from cat to cat. You can remove them, just be aware that that's what they are. Okay. So I can already see, without having to do a whole lot, this is the urethra. Okay. Now, female anatomy in the human, we have separate openings for reproductive and urinary system. Cats have one. So juvenile males and females look exactly the same because they both only have two openings, the rectum and then their urogenital opening. Okay. So until this testes fall, you can't tell male or female kitten apart. Okay. In order to see this, we're going to cut through the pubic symphysis. Remember, it's just cartilage, so I can actually do it with a pair of scissors. And again, when you do this, be cautious of the bone